Our first presentation today is Professor Fellow Eve Adams from New Mexico State University.
Thank you, Larry. I heard that about 8 minutes, so I might exploit that just a little bit. Okay, so I'm going to start with jumping right in, and I'll start with talking about connections. It's a central human necessity. We're hardwired to be relational and to desire authentic and mutual connections. I was blessed to be born a twin and to have this mutual connection throughout my life with my sister Anne. However, despite this strong connection and a loving family, I would also describe much of my cultural socialization as weird. And by that I'm referring to Heinrich's acronym here of Western Educated. I'm going to focus on the individualism part, rich and democratic. It's one of the least representative populations one could find to generalize about humans, and I'd really recommend you reading that article, as it does a great job of talking about how that doesn't represent much of the human population. What's particularly troubling about this socialization is the overemphasis to me on individualism. Both personally and professionally, I've found it troubling because I think it creates lots of experiences of disconnection at multiple levels, leading to a lot of psychological distress. But I was fortunate to have several counterweights to my socialization as a weird individual. These experiences included being a twin and being a feminist lesbian who learned about feminist therapy from Karen Taylor, Nancy Betts, and Louise Dowse, and learning about Afrocentric thought and optimal theory from Linda James Myers. While I was a doctoral student at Ohio State University, I had the good fortune to be a part of this research team in which we developed the optimal theory applied to identity development. And you'll be hearing from Amy Reynolds, one of the other authors and member of the team, in a few minutes. That's about, I think, 1986, maybe, something like that there. This developmental model describes a developmental process by which people move from a more Eurocentric or weird worldview to a more Afrocentric or interconnected worldview. It is our contention that oppression, hierarchies, and other forms of disconnection can be transformed through connecting with the devalued parts of self and through others who share similar characteristics and experiences. And as a result of this process, I started to envision how I and others could maybe experience a more integrated and holistic sense of self and connections with others in the world. This work was transformative for me both personally and professionally, but given my strong individualistic socialization, much of my application of the OTAID model and the interconnected worldview was focused on the individual level. And I was challenged to stretch beyond this level when I moved to Las Cruces, New Mexico, to work at New Mexico State University, and I was immersed in a community that was far more collectivistic and also facing many more forms of systemic oppression. Las Cruces is located in Doña Ana County, which is largely rural and low income. In addition, as is the case for many rural areas, the health system is inadequate to meet the needs, which in federal terms is called a medically underserved community and designated as a health profession shortage area. So access to mental health services is particularly lacking. Inspired by Liz Vera and Suzette Spite's 2003 call to the profession to ground our understanding of multicultural competence in the concept of social justice, and informed by the prevention work of my colleagues, particularly Michael Waldo and John Schwartz, I saw a role I could take. I saw how the OTAID model and an interconnected worldview could help make our healthcare system healthier. After all, the individualism of America is manifested in a decontextualized understanding of health in a segmented, siloed healthcare system. In 2004, the concept of integrated healthcare was a relatively new idea, particularly in primary care settings and particularly in rural areas. Okay. So I'd like to focus just a moment on the word integration. Dan Siegel, in his book Mindsight, stated that integration is the main mechanism to produce well-being. At the individual level, health is enhanced by linkages of separate processes, such as increasing the connection between the mind and the body. At the system level, we have to create more linkages between healthcare providers of various disciplines, create more pathways for patients to receive care, and provide services that are culturally responsive. So I learned about this thing called the Graduate Psychology Education Grant from Jeff Baker and Stephen Cook, who had received some of the earliest GPE grants, and they encouraged me to apply for one, and we've received funding for 11 years. The grant supports curriculum development, supervision for our doctoral students in counseling psych as they serve low-income and linguistically diverse populations in primary care settings that are interdisciplinary, including a family medicine residency training clinic, a federally qualified healthcare center, and school-based health centers. Given our location on the U.S.-Mexico border and because some of our students are bilingual, we also build in a Spanish counseling minor. So you can see all the disciplines involved in the grant and the number of trainees who've engaged in some form of interprofessional training over these years. What I want to stress is that our doctoral students in counseling psych aren't necessarily coming to the program interested in health psychology, but they're extremely committed to social justice. So the idea of reducing health disparities and providing culturally and linguistically competent care are their major motivators. So how do we do that? How do we take our students and take their traditional counseling psych skill set and become an effective part of the healthcare team? Well, they take these different courses in their third year, and they're all taught by my talented colleague, Dobney Harper, and they involve all the faculty from these various disciplines listed, as well as a medical anthropologist. So in the summer, they take an interprofessional immersion where they learn about the other trainees' disciplines, they learn about how to communicate effectively in teams, and then they go around into communities and engage in some public health visits. Then they take a primary care class where they learn about the biopsychosocial model and psychological aspects to chronic diseases, and then finally they go into a practicum where they serve as behavioral health consultants in those settings. And if they're bilingual, they get to receive some of this training in supervision in Spanish. Now, I just want to highlight the mindfulness course as one other part of that. It's not required, but a lot of students take it. And why do we do that? Well, I'm just going to highlight that it's great for a lot of different patient interventions for a wide range of conditions. It's also really great for self-care, which the students really need as they manage the anxiety in that new system. And then the last one, I think in terms of being social justice advocates within the healthcare system, they come at it a little more wisely. Ultimately, I believe that the trainees will be of greatest service to others if they are given the opportunity to experience the mind-body integration, not just understand it conceptually, and connect more deeply to this present moment. I believe this because my own mindfulness practice has made such a difference in my life. It has allowed me to more fully experience moments of interconnection and compassion for myself and for those around me, and it has allowed me to experience a sense of wholeness that I only understood conceptually within the OTAID model. Part of this practice is to focus on moments of gratitude. So in closing, I will share that I greatly appreciate the many talented colleagues and friends who I've had the good fortune to work with, some of whom are pictured here as well as in the audience, as well as my amazing students, many who are also in this audience. And finally, I want to take a moment to express my gratitude to being able to share this journey with my wife, Betsy Cahill, and our son, Jesse. They help me find balance and provide more love than anyone could ever possibly expect. Thank you.